Welcome to your online training course entitled You Make Me Sick. This course will cover the basic information about infectious diseases and exactly who is responsible for making our kids say, "You make me sick." We will cover the following areas of infectious disease: what makes us sick, how infectious disease spread and how they can make us sick and why it's important to learn about them, and ways we can prevent and minimize the spread of infectious disease in the classroom. The first section that we're going to cover is what is an infectious disease and why is it important to learn about them. Working in a child care center, you've likely encountered a sick child or have been sick yourself. The big question is what is responsible for causing us to become sick? The answer is germs. Germs are microscopic organisms that are all around us. Some are good, and others are not. Good germs help our body stay healthy. The digestive system needs germs to break down food and absorb the nutrients into the body. Other germs help our body to heal, like the germs that are found in penicillin. These germs are actually responsible for saving lives. Many illnesses that were deadly are now treatable thanks to this germ. Some types of germs are found in the foods we eat, such as yogurt and bread. But not all germs are good for your body. When one of the bad germs invades your body, it can cause you to become sick. Let's take a look at the 4 different types of bad germs that make us sick. The first type of germ is bacteria. Bacteria are organisms that invade the body and give off toxins that make us sick. Bacterial infections are usually treated with medication. Most often, antibiotics are used to fight the infection. Out of the 4 types of germs, bacteria is the most common cause of illness and even death throughout the world. The next type of germ is a virus. Viruses invade the body and take over cells, stopping them from doing their normal jobs, which will eventually make us sick. Once the virus finds a host, it can reproduce. When the virus begins to reproduce, the body fights back through our immune system. Often viruses are not treatable with medication. Sometimes viruses are preventable through immunizations. We'll discuss immunizations later in the training. The third type of germs are fungi. Fungi are tiny organisms called spores that can live on the body or on other objects. Most fungi cause infections in the lungs or on the skin. The symptoms of the illnesses vary based on the type of fungus and where it's located within or on the body. Fungal infections can be treated with medication. The medication used depends on the type and location of the fungal infection. Do you remember the first type of germ we talked about? It was bacteria. Do you remember that we said some germs are good? Some types of bacteria keep fungi from reproducing and infecting the body. When a person has a bacterial infection and takes an antibiotic, sometimes the medication can kill so much bacteria that even the good kind of germs are destroyed. When good bacteria is destroyed, fungi can grow in the absence of the bacteria that would normally keep it from causing an infection. It's important to contact your doctor if you develop a fungal infection while taking antibiotics. The last type of germ is a parasite. Parasites are nasty little guys with a mind of their own. Parasites can be microscopic organisms, worms, or they can live on insects and spiders. The treatment for parasites depends on the type of a parasite and its location in or on the body. So now do you know what makes us sick? That's right, it's germs. Now let's take a look at how these germs can grow into an illness. Illnesses caused by the invasion of germs are called infectious diseases. Infectious diseases that are passed from one person to another are called communicable diseases. Now that we know what makes us sick, let's look at how we get sick. So why is it important to learn about infectious and communicable diseases? Communicable diseases are the most common infectious diseases found in child care centers. Understanding how they start will help providers understand how to prevent them. So how do diseases pass from one person to another? Is this really what we had in mind when teaching our children to share? The way a germ will travel from one person to another is called transmission. There are 4 types of transmission. Let's take a look at each of them now. We'll take a look at contact, air, fecal-oral, and bloodborne. The first type of transmission is contact. This can be direct or indirect. Direct contact is when the infected person touches another person and transfers the germs to the unaffected person. This can happen through a handshake, hug, or kissing. Indirect contact is when a person touches something that has been infected and then touches their eyes, mouth, or nose and transfers the germs to their own body. Some germs can live just about anywhere and for various lengths of time outside of the body. Germs can live on a hard or soft surface, wet or dry areas, and with or without fresh air. It's time for an activity. Pause the presentation and think about all of the places in your classroom that the children touch each day and write them down. Then circle the most common places children could encounter germs. The most common places germs can be transmitted are from doorknobs, countertops, bathroom fixtures, toys, bedding, toothbrushes, combs, cups, or utensils. How many of those items were on your list? The next way germs can be transmitted is through the air, known as airborne transmission. Airborne transmission is when germs take flight, typically when an infected person coughs or sneezes. Because germs are so small, they can fly pretty far. Germs can also be carried on air currents, both indoors or outdoors. That means that you don't necessarily need to be sneezed or coughed on to have germs make you sick. You could simply be standing next to an infected person and breathe in germs that become airborne. The next type of transmission is one that makes people's stomachs churn. Proceed with caution. The third type of transmission is fecal-oral. Sounds gross. Well, it is, but it does occur, and unfortunately, more than we'd like to think it does. This type of transmission can be very problematic in classrooms where children are wearing diapers or learning to use the restroom on their own. Fecal-oral transmission occurs when microscopic amounts of feces infected with germs are transferred to another person's mouth. Remember, we are talking about microscopic amounts. That means they are so small that you can't see them on your hands or surfaces. Germs can be spread through improperly washing hands after changing diapers or assisting children with the restroom. This includes improper hand washing by children and staff. Germs can also spread when diaper changing areas, toys used to occupy children during diaper changes, or restrooms are not properly disinfected. Fecal-oral transmission can occur both directly or indirectly. Do you remember the difference between direct or indirect contact? Direct contact occurs when you touch another infected person and transfer germs, and indirect contact occurs when you touch objects that have germs on them. The last method of transmission is blood-borne transmission. This occurs when a person comes in contact with infected blood. Infected blood must pass directly into the uninfected person's bloodstream. It may seem unlikely that this type of transmission would occur in a child care center, however, it is possible. Child care professionals should be mindful of the condition of skin on their hands. Frequent hand washing strips the skin of essential oils and may leave hands dry and cracked. If gloves are not worn, blood-borne transmission could easily occur through dry, cracked hands. Let's review what we've covered so far. There are 4 types of germs that cause infectious disease: bacteria, viruses, fungi, and parasites. Infectious disease becomes a communicable disease when they are transferred from one person to another. And passing a communicable disease occurs through transmission in one of 4 ways: through contact, airborne transmission, fecal-oral transmission, and bloodborne transmission. Do you think you know your stuff? Well, it's time for transmission trivia. Let's look at a few examples of things that commonly occur in the classroom and determine how the germs were transmitted. Kara and Javier are playing with blocks. Kara's nose is running, so she wipes it with her hand. Javier asks Kara to pass him a block. She gives her nose one last wipe and hands Javier the block. A few days later, Javier has a runny nose. It was so nice of Kara to share her blocks, but how did Kara share her germs? That's right, through indirect contact. Sarah has also been building blocks with Kara and Javier. She too has a runny nose and has been wiping it with her hand. When her mother arrives to pick her up, Sarah grabs her mommy's hand and pulls her over to show her the tower she built. Sarah's mom rubs a piece of dust out of her eye. If Sarah's mom becomes sick, how will her potential illness have been transmitted? If you guessed direct contact, you were right. Let's take a look at another situation. Jamal is riding next to Katie on the bus. He has a cold and is coughing a lot. Katie later develops a cold. How did transmission occur between Jamal and Katie? You got it. It was airborne transmission. In our next scenario, Tanya is changing Camila's diaper. She hands her a toy to play with while she changes her. She finishes the diaper change and takes the toy away from Camilla, putting it on the changing table while she washes Camilla's hands. She gives the toy back to Camilla after she's done to keep her occupied while she disinfects the table. Tanya did the right thing by washing Camilla's hands, but what type of transmission could have occurred when Tanya didn't disinfect the toy before giving it back to Camilla? That's right, fecal-oral transmission. Okay, are you ready for another one? Jenny is playing outside when she falls and scrapes her knee. It begins to bleed. Her teacher, Victor, grabs the first aid kit and begins to clean the wound. Victor puts a Band-Aid on the wound and sends Jenny on her way. By cleaning Jenny's wound without gloves, what type of transmission did Victor expose himself to? That's right, blood-borne transmission. Did you answer all the trivia questions correctly? Well, if you did, Great job! It's easy to see through these examples how transmission can occur. Many of these examples occur multiple times during the day, exposing children to several potential illnesses. Now that we've covered how we can get sick, let's look at what happens after transmission. Transmission has occurred. Now what? Germs take time to develop into an illness and begin to show the symptoms they cause when we get sick. The time it takes a germ to invade a body and develop into an illness is called an incubation period. Incubation periods will vary depending on the type of germ. For the most part, each type of germ will have a similar incubation period. You can find the incubation period, as well as other important information on the childhood infectious illnesses, on the Center for Disease Control's website at cdc.gov. So how can knowing the incubation period of an illness be beneficial to childcare professionals? Incubation periods gives childcare professionals a time frame to watch for the spread of the disease. Incubation periods also give childcare professionals an idea of when transmission of the illness may have occurred and who may have been exposed.